everybody. Hey Gooders, good to see you. I am here with my friend Donna Wilson, and we just shot a program for you called Strong Bones, all about osteoporosis and osteopenia. So we're going to kind of go more in depth. I know she gave you a lot of tidbits during the workout. If you were listening, they're so good. But I just kind of wanted to sit down with her because I know you guys may have questions. I have questions. But before we get started, Donna, can you tell us a little bit more about yourself, how you got started in medicine?
Well, I've been a nurse for 53 years and a clinical nurse specialist, cardiopulmonary. I'm a respiratory therapist. I've worked at Mass General for 20 years and now the last 30 years at Memorial Sloan Kettering. It really occurred to me about 20 years ago that people needed to move after cancer. And so I have been the clinical fitness specialist at Integrative Medicine at MSK. And then what happened is you see all the treatments especially I did a lot with breast cancer and prostate cancer. And you see that these drugs really sort of create patients to get osteoporosis. So probably about 15 years ago, I started a class called Strong Bones. And now the goal is that you look at this, and now you look at the big picture of osteoporosis. 50% of women get osteoporosis. 5 to 7 years after menopause, you lose 20% of your bone mass. That's with just living your life the way it is. Now, you know, we start looking at bone density. If you might have an illness and they say, okay, well, you had cancer treatment, you might have a bone density because they know that particular medication leached the calcium out of the bone. But if you're a normal person, you just go about your life. In your 50s, your doctor may say, let's get a bone density to see where you're at. This is the key. If you are on medication like steroids for a treatment, on chemotherapy, actually there's some antidepressants, diuretics, there's a whole list of medications that sort of can give you mild osteoporosis or osteopenia, because that's what those particular drugs leach the calcium out of the bone. It could be on your sex. Men have a higher bone density than women. Or it could be your race. Black women have a higher bone density than white women. Asian women have a small bone structure and there are higher incidence of osteoporosis. It could be genetic. I'm 74 years old. My mother, my grandmother, they all had osteoporosis. And the key is that I am fit and I work out all the time, but I still have osteopenia of my left hip. And it's probably because it's genetics. It's not, some things we don't have the power to change. I have the power to maintain osteopenia with exercise and diet. And that's what I choose to do. We're not going to spend this time, and I'm just going to put this qualifier in, and talking about the medications that they can provide you for osteoporosis. I'm a believer of using your body weight and pressing the muscle down on the bone to really activate calcium and activation in the bone. All the time, by the way, 10 to 15, 20% every year you have an exchange. You release some old bone and then you get absorbed. So why is that important? That's why you need calcium. That's why you need magnesium. It's why you need phosphorus. It's why you need, K2 and vitamin D3. All of these things work together through enzyme functions in the body to keep the calcium in the bone. So it's not just taking calcium. You really need to do it all. Vitamin D3 is extremely important because vitamin D3 really opens up an enzyme to get the calcium into the bone. Now, vitamin D3 is very, very important, and we have a blood value that we can get. There's an assay, we call it, in medicine, and you can, when you go to the doctor, you want to say to them, can you really do a blood test for my level of vitamin D3? If your vitamin D3 is below 30, you should be taking a supplement. Now, right now we're near Princeton, New Jersey, in Hopewell, and I live in Weston, Connecticut. On this latitude, we really don't get a lot of absorption of vitamin D from the sun. And on the other side is we can't lay in the sun anymore because it's not good for our skin. So it's a catch-22 all the time. But really, taking 2,000 units of vitamin D3. Now I say vitamin D3 because vitamin D3 is absorbed better than just straight vitamin D. So you want to make sure you do it, and then don't overdo it, but really have your level checked. So there's so many things involved. And the influences of how you get it, some we don't, as I told you, you don't have control. But the most important thing we do know through multiple studies, that when you push down, as I've said in the videos, take those shoulders and push them down. Now, what does that do? That pushes this big muscle in your back, it presses on the ribs, and it presses on the spine. The other thing to remember, you've got two types of bone. You've got these long bones here in the thigh, the femur, and they're really stronger. Then you have some other bones that are in the spine and in the wrist that are not as strong or concentrated, like they're a little bit lighter. So that's why when they check you for osteoporosis, they check spine, they might check your wrist and hip. So those are the three areas that the most common area is for osteoporosis. I'm going to here and talk about your bone density test. It's a little overwhelming because you see minus numbers and you think, oh my God, it's all bad. If your bone density is -1 or above, your normal bone. If it's -1 to -2.5, it's osteopenia. So if you took a beautiful lace blouse, and then you took the blouse and you had a few little rips in the blouse, and you see open areas, that might be osteopenia. Whereas then with osteoporosis, where it's -2.5 and below, because you can go as low as -0.3 or -3.5, you're going to see a lot of open areas. Like there looks like there's just the lattice work is very little. So you say when it's like that, there's a high incidence of fracture. Now, let's talk about fracturing. There's over 300,000 hip fractures a year, and it's usually right into the neck of the femur, and they do check that. The problem with that is that if you're not in good physical shape and you fall and break your hip, there are statistics that show 6 out of 10 women and men that get a fracture of the hip, 6 of them never get back to their full independence. That's a lot of people. So what I'm saying is that if you have a hip fracture, you get it repaired. The repair is a lot easier than it used to be now. Sometimes they do an anterior approach or a posterior approach for a hip replacement. But then you get that fixed, and then you're too weak to really be active, so you go to rehab, and then in rehab, you might get something else, and sometimes you live in rehab for a very long time. So by watching this video is we want to take women 40 years old and greater and do this all the time. And think about when you're exercising, how am I engaging the muscle? To be honest with you, you can actually get osteoporosis in any bone of the body. Okay, we have so many bones all over. But you can get it in the forearm, you can get it in the femur. It's just that we look at the bones in the spine, the hips, and the wrists most commonly. There are over 400,000 wrist fractures a year. And it's usually common that it goes up into the radius, this bone that goes into the elbow. And commonly you can get it repaired and fixed. But let me just tell you, you have a wrist fracture and you're like this, it's hard to get dressed, it's hard to do anything. Why is this, I'm saying this, is because when you do fall, what do you do first? Your hands go down. And that's where you can have a simple little fracture of the wrist. So what I'm saying to you is strengthening your body, getting the muscle strong on those bones. If you fall, you may not hurt yourself. It's sort of like a catch-22. The weaker you are, fall, high risk of fractures. The stronger you are, the more protection you have onto the bone. If you fall, then you may not fracture something. So that's kind of a lot of it in a nutshell, but the truth of the matter is I want, and I have a tagline, and my tagline is keep moving. And I would say that the most important thing you need to do in your life right now is to just keep moving. Whether it's walking, stair climbing, you want a little cardio, you want a few little things to get the heart rate up. But I'm going to tell you a very simple one. Hips, you think, oh, I don't like to jump rope, I don't run on the treadmill. If you do 50 heel raises a day, research has illustrated after 6 months and a year, they did it in many women, they showed that just doing 50 heel raises a day increased their bone density. Now that's a big deal. So I'm giving you something so simple to do, and you could do it brushing your teeth, you could do it in the kitchen when you're doing the dishes, up and down on, get those heels up. And when you do 50, you're gonna feel that all the way up into your hip, because what happens is that your calves feel it, then it goes to the hamstrings and your big quadricep muscles, and then into your hip. So that is one thing for your hip. Your spine is really a little harder because it's commonly, well, let's do two things. One is your posture. Your posture is so important because of lung function. And I've been a lung nurse for a long time. If you sit like this and round your back out, you've decreased your lung volume. So now you have to breathe harder and faster. If you lift your chest, shoulders down your back, you've opened your chest to breathe, but now you have a straight back. Now, I'm going to do this again. I'm going to round my back out. And now you have a cervical spine, thoracic spine, lumbar. This thoracic spine has 12 vertebrae, and they curve. When they curve like this, I call this C-shaped spine, a no-no. Why is that a no-no? You take all the muscles of the back and pull them away from the spine. And so then there's no pressure onto those vertebral bodies. So posture is key. So make sure, and with this day and age, with computers and the phone, we're all like this. Stop, put your hands on your thighs, lift your ribs up, shoulders down, so you have a really nice tall spine. So that's one thing you have to do. Shoulders back. All the exercise we did in these videos are really, we tried to target. They might be fun or slightly different, but we're targeting that spine, we're targeting your hips. Now it comes to the wrists. Wrist curls, wrist extension, open and closing your hands, stretching your wrists, towing your elbow, your fingers around. You want to do all that because you want to make sure that this stays as healthy as you can. Because if I took somebody, say you fractured your forearm, if you had a cast on, and if I took 5 people, they all were right in front of me, this one had a cast on for 8 weeks. If I did a bone density before, it would be normal. If by putting a cast on here with no movement, and I looked at your bone density in 8 weeks, you would have osteopenia already from lack of movement. So it shows that the movement of the muscles in the forearm press against that radius and bones, and then you get pressure onto the bone. So I'm going to stop for a second because I can get pretty chatty. So what I'm going to do is make sure that Esther doesn't have any other specific questions.
Actually, I do. I'm kind of glad you brought up that cast story or the analogy. If you were a healthy bone and then you had osteopenia after being in the cast for 8 weeks, could you reverse that?
Yes, by doing wrist curls. Go look, if I go like this with my wrist and I'm holding it, all the muscles are pushing down into those bones. If I do a wrist extension, you can feel and I would do it with light weights. Don't do it so you hurt yourself, but I like doing it that your elbows are on your thighs, you hang your wrist over your knees, and you do it slowly. Doing it like this doesn't do anything. You come up and then you say, hold 1, 2. So when you hold 1, 2, the muscles are pushing into that. So yes, you can reverse that.
So so that's it. How about for your spine?
The spine's a little bit harder, but you can, what I look at when I look with people with spine, I look the fact that you're not getting worse. So bone density doesn't change dramatically. That's why they only do one every 2 or 3 years. It depends on what the issues are with your body, how they do it. But the truth of the matter is it a lot has to do with your core for the lumbar spine. So one of the things, you never bend from your waist. You bend from your hips. So if you have a slight bend, so you bend from your hips, push the shoulder blades down the back, so now you have a flat back. Now, when you want to come up, you just don't come up. That's wrong. If you lift, breathe out, tummy is tight. Now what you do is, before you come up, breathe out, tuck the tummy in, and so you protect the back. So there's lots of exercises that Esther and I can do for you, but a lot has to do with the core. You don't want your core to get flabby and weak. You want to keep the core stronger. You know, we don't isolate muscles in the body. We can't just say, years ago, I remember when I first became a trainer, they said, oh, why don't you just do this muscle and you can train? We're all connected. We're connected from here to here to here to here, and connective tissue throughout, and fascia. We need to keep ourselves flexible, but you don't do muscle isolation. So when I'm bending my hips, I'm using low back muscles, I'm using my thighs, I'm using my core. So you want to incorporate all those, but for low back, you really want to work on those core muscles.
Yeah, so I love that you're demonstrating all of that, because I know, looking at some of the instructions from previous years, I'm talking like decades ago, if you talk to them and said, hey, I have osteoporosis, what were some of the things that we weren't allowed to do, like twisting, bending? So I guess I kind of want to get into like, what are some safe exercises versus like, don't ever do this because it's like terrible for you.
Sure. So just the first one we just said is we bend at the hips, not the waist. So because I hear instructors and people say, well, bend at the waist. No. My waist is here. If I bend here, that's my lumbar spine. And then my hips are straight? No. So the first is, you want to stand up and you want to elongate your body. So that's bending for the hips. Then they talked about no twisting. And twisting is really twisting. Turning side to side is not a problem, because what you're doing is activating the oblique. You have internal and external oblique muscles on the side here, and you want to sort of activate them. You want to get them so they're not just soft. You want to get them so they're a little stronger. So I don't use the word twisting ever, but I do go turning. Bending is we just talked about, but that's the big thing. So when you bend, if you had severe osteoporosis, like, wow, -3 on your lumbar spine, then you would have to say to somebody, can you teach me the proper way to pick something up? You're never going to go like this. That would be a no-no. But you might take 1 foot forward, 1 foot back, and come down, pick it up, and breathe out, lift it up. Yes, it's a little slower, but you would probably also find the more you did it, the more it would be easier. And then maybe in a year or so you go back and your osteoporosis is like, it's not normal, it's not -3, but it's now -2.5. That went to osteopenia. And I have to be honest, I have taken many women, because I've been at Memorial so long, the women after breast cancer are on these medications called AI, aromasin inhibitors. They really cause you to remove all the estrogen out of your body, and because of that, and it's a hormone, and a lot of hormone reactions, more calcium is removed out of the bone, so therefore you get osteoporosis. Meanwhile, they could be exercising and doing fabulous, and they still get osteopenia or osteoporosis. Those women with diet and exercise, not taking any medications, have improved their bone density. And I have numbers to prove it. So I feel very excited about that. It's consistency. So I have a couple of words that I've used over the years from dealing with all kinds of lung patients and all kinds of patients. Patience, consistency, and make the time. Now, what I mean by that is that if you have osteoporosis, you want to do your strength training 3 times a week. You want to not just go but real quick. You want to think about it. You want to up and then push the shoulders down. You want to do the bicep curl. One that's the best one is shoulders back, So if I go like this and I pull my shoulders back, your shoulder blades are going into that cervical spine and the upper portion of the thoracic spine. You've got 12 thoracic vertebrae, and they like to curve. They like to give you that round look. And then what I would do is we would just then go down here and reverse fly. You open your, and feel all those muscles pressing into the ribs and pressing into the vertebral bodies. So those are the kinds of things that you want to really do. And the hips, of course, it's lunges and squats. You don't have to go low. You could do it modified as long as you engage the muscle. So if you're doing a squat, okay, I could do a chair squat. Chair squats are fabulous. I put my hands across my chest. My ankle is in alignment with my knee. My knee is in alignment to my hip. I cross. Now, the second I leave the chair, I squeeze my butt cheeks, which those gluteus maximus are huge. They squeeze right here. I've used legs, core, and hips, so it's really protecting my hips. So there's not that you say, oh, I can't do squats. Oh, I can't do that. There's always modification to make you to be able to do the exercises.
Yes, and I think that is so important to have a trainer who is knowledgeable about something like this. And I'm so glad that you have a program out, and now we're going to put a program out here in Gooder so you guys can see what we do. It doesn't have to be complicated, but it is consistency. I wanted to ask you one more thing about exercise. I know some people are, about high impact, like HIIT training. Do you think that that is very beneficial for osteoporosis and osteopenia?
Well, I think it depends. I mean, if you have osteopenia, I would say that yes, you can do it. And one of the things that you can do, and there was a wonderful orthopedic surgeon that I have met from Canada, and she advocates this. It's flat foot jumping. So what you would do is when you do your heel raises, and then you come down, and you don't have to necessarily come up high, but you would just do a flat foot jump, landing on your heels. When you land on your heels, the vibration goes to the hip. And she advocates this, and I know a lot of other people do as well. If you have really significant osteoporosis, then I would say you would lift your heels and push the heels down into the floor, but don't actually jump until you feel that you're strong enough to do it in a controlled manner. But yes, you can make a difference so high impact is yes, as long as you are knowing what you can do for your body. But I don't think it's wrong at all.
How about like biking and like elliptical where there's virtually no impact? Could that also help strengthen your bones? Because I know some of us have arthritis in our knees, and it's really, really hard to, like talking about being consistent, like sometimes I have to take a day or two off in between. But I still want to do something. Could that be helpful?
Absolutely, because there's not as much, when you look at the elliptical, there's not as much stress on the joints. So that's why we like it. But it's still moving all these muscles. It's moving the quads, because you have a big femur, a huge bone here. You have your hamstrings. You have your hips. So when you're on the elliptical, it really does work. And it's the same with the bike. I do the bike a lot, as Esther. At my age, I do have very significant arthritis of my knees, but they're not swollen anymore because I keep my quadriceps really strong. And I love my Peloton. I go on it a couple of times a week, and it makes a difference. So yes, if you say my knees are really terrible today, then go on and do something with no resistance, but keep the motion, keep the mobility, because you can strengthen, but you also need mobility. So you could say, today, I'm not going to do a strength training with that, but I'm going to do a mobility, and I'm going to keep myself as flexible as I can.
I'm so glad you said mobility, because you and we do put a lot of focus on mobility. And I really feel that we don't mobilize enough in this country. Like when you go and look at Instagram, for instance, and you go on any fitness pages, they do the basics, like the compound movements. But I don't think a lot of people put enough emphasis on it. Could you tell us how important mobility should be for osteoporosis and osteopenia patients?
Sure. So if you know that your muscles are connected to the tendons and to the ligaments, right? Then you have connective tissue. Then you have fascia. Fascia is like layers of, saran wrap, all kind of layers. And if they get sticky, things don't move. It doesn't move. So what happens is that the flexibility, like I love doing flexibility because it makes me feel loose and comfortable. So I do one that I've done for many years. It's a figure eight. You could do it on the side figure eight, you could do it in front, and you want to open the chest because you don't want to keep those muscles tight. You want them to be flexible so that you can contract them to push down on the bone. So anytime you do anything, it's really good to think about, just doing arm circles or, pushing the shoulders back or just wiggling your hips. I mean, one of the simplest exercises to do for your hips is just put your toe into the floor. Internal rotation, external rotation. That's simple. You could do it at the sink, you could do it at home. 10 on the right, 10 on the left, because it keeps the mobility. When things start to get tight, the fascia and the connective tissue, there's more pull on the muscle. Then you don't have the same level of contraction, and then you sometimes get muscle spasm because they're not as flexible. So yes, it's very important.
Well, I love this conversation. She and I can talk about this forever. But I did want to touch a little bit on diet, just because I know that exercise alone is good, but combined with a really good diet, you really can make a big difference in osteoporosis.
Absolutely, yes? Absolutely. So, it's very simple. It's, you want to decrease the amount of sugar that you take in, because sugar is not good for any of us, unfortunately. And it doesn't mean that you have to drink tons of milk. I don't eat dairy very much, but kefir is a great drink that has a good calcium amount in it, if you like that. A yogurt here and there is very good for you because get the Greek yogurt. It's a higher content of protein because you need the protein stores as well for all the enzyme function for the bones. But it's little things that when you start to think about nuts. Now this is the hard one. Nuts and seeds are terrific, but nuts have a lot of calories. So as much as I say almonds and walnuts and pecans and Brazil nuts, which are really good because it has selenium in it. Not only Brazilian nuts are good for the bones, it's good for the brain because it says selenium. But you make sure that you either count them out or you just take a quarter of a cup. Because a quarter of a cup of nuts is about 200 calories, give or take 10 here and there depending on the nut. So those are the kinds of things. Or you want to look at, your salmon or your mackerel or your sardines. I know that sometimes people don't like it, but I'm a fan of sardines because they're very, very healthy for my bones. And there's many companies out there, and some are better than others. But you really want to look at, all the greens that you can get and all the spinach you can get and that kind of stuff. You can list it all out. I have lists and lists here. So let me get this because I can't remember every one, but I like to always go over a few. Calcium, of course, is in it's in salads and soups. You can put it in bok choy, has a good amount. Sesame seeds, broccoli, collard greens, mustard greens. That's great for calcium. Phosphorus. Now, phosphorus, I'm going to add a little thing in, and I did mention it earlier in one of the videos, but phosphorus you need, again, for your bones, and it's leafy greens, carrots, coconut, pears, apples, avocado, dates, and fish. Now, I'm an advocate of no soda. I have never thought soda was good, but I could tell you what soda is to me. Soda, which has phosphoric acid in it, so it tastes good for a long time. We view that as osteoporosis in a can because the phosphoric acid breaks down the calcium in the bone. So people that are high, and this is not just, it's regular soda, and it can be diet soda. Salsa is not the same because salsa has no added taste because usually the taste is an essence of a flavor. So be careful, but so be careful about, I know that people drink a lot more water these days, but I'd rather you drink flavored water than anything else. You also need boron. Now, boron is an interesting thing. Where do I get boron? Well, again, there was another study. Years ago, they gave women 10 prunes a day, and they increased their boron and they increased their bone density. The truth is, 10 prunes can be quite a lot for some people. As myself, it's not too, it's too much. So I find 5 is perfect. I eat usually 5 prunes a day, sometimes 4. but it has boron in it, and that boron is really strong for your bones, as well as almonds and dates and avocados, but 4 to 5 prunes a day really do the trick. Celery, which you don't even think about, has lots and lots of minerals and boron in it as well. Copper you need, that's usually up. Copper is good because it has dark chocolate, so that's a good one for you. Silica, zinc, which is in shellfish and dark chocolate and sardines. But the truth, pine nuts have good potassium in it. You really need all of these things to put together. So the key is what you want to be mindful of, not too much red meat. And I'm not saying you eliminate it. I'm saying just be mindful that you don't do it 5 times a week. Once to twice a week is perfect. Think about your fish. Think about what types of fish you got. And then think about, you don't want to have very high in the tuna because there's a high mercury there. So you've got to figure it out, but there's also lots of vegetarian meals that you can make. And I'm not saying become a vegetarian by any stretch, because I do like meat as well, but it's just moderation, not overdoing it and being mindful. There's lots of good websites online, and there's one website that I think if you wanted to look it up, it's called Save Our Bones. Save Our Bones has a phenomenal dietary list of what's good foods for you and not that you should eat and shouldn't eat. It also, she's great because this woman was diagnosed with osteoporosis in her 50s, was immediately given Fosamax, which I'll tell you a little story about in a minute, and went home and thought, looking at all the side effects of this medication, why do I want to take this? So she developed this website maybe 15 years ago. She puts all the most recent research on it. She does have exercise programs. I don't think they're as good as ours, but I think they're good. And then she has stuff about nutrition there. Now, let me just tell you, years ago, people had fractures. They never thought about osteoporosis. In 1995, they decided, because people were having fractures, that osteoporosis, they thought was an epidemic, because they were finding x-rays were better, we found more. So what came up in 1996? The development of Fosamax. So the farm drug companies went crazy because everybody went on Fosamax. Well, did you look at the side effects of Fosamax? Then it came out with Actonil. Now we have a whole list of these medications for for osteoporosis. The only thing I'm going to tell you about all these drugs is please be mindful and look at the side effects. They do affect lots of other problems in your body. Actonil can give you esophageal ulcers. You look at if your doctor says you really need to go on this, I really feel strong about it. Before you take it, go to your dentist and ask him to see how healthy your jaw is. Do you have the health of your jaw? If your jaw is really healthy, some dentists will just say flat out no. Just absolutely no. My dentist told me absolutely not. Because what will happen is your jaw will start to disintegrate, and you'll have to have your teeth will get loose. And then you have to have reconstruction. And that's on you, not anybody else. So be mindful, go to the dentist, look to see what the drugs are causing. If you have any side effects of those drugs, then report them and then think about it. But remember, go back to the basics. Exercise and diet can make a world of difference.
This is so good. All right, so I after just listening to you, it just kind of comes down to, like, we're personal trainers. And for me, it's really important that we have a variety of exercises, not just like the compound movement, but if you train with me, I do the animal flow, TRX, stuff on the floor, I bring variety in because I really believe that makes you a stronger athlete. And now looking at the diet and everything that she says, it's the same thing. You want variety of diet so that it really supports all the vitamins and minerals and nutrition that you need in order to get better. And let's talk about just as a whole, it's your lifestyle. It's got to be just like that. We are very sedentary right now. Everyone, we work from home. My kids are sedentary, so we have to be intentional about getting up, setting time aside to work out, or maybe you have a watch or on your computer, you could have a reminder where every hour on the hour, you should get up and move. You should not be sitting still for like 2-3 hours. Our bodies were not meant to sit on our tush. So having listen to all this, I hope that this motivates you. It's not just because, oh, movement is, of course it's good, but this is for your longevity. Having some issues with my knees now, like I don't want to live in pain. So my goal is to do things that are going to get me healthier, not load, because like ego-wise, I want to go and like work out really hard, but I know that's going to probably put me out of commission for a while. So take a step back, please take a look at it. I hope you do the workouts that Donna has led us through in this Strong Bones program, because I assure you, you do it, at first it might feel easy, but the more your mind and your body connect, the same movement is going to feel completely different to you. And that's our goal for you. We want you to be so connected that you can feel even just like pressing your thumb and index finger together.
So look here
right?
we are, I press in my thumb and index finger. Here's my arm. I press my thumb and index finger. Look what happens. Everything's engaged. Or the easiest one to do is go in the mirror. Shoulder up, shoulder down. I don't feel anything. I don't feel anything. Shoulder up, push the shoulder down, and then you get all these muscles down here engaged. So it's mind to muscle, as Esther said. It's so important.
And that engagement is going to make your bones stronger. So it's not just about lifting heavy weights. It's about how you engage your muscles. And I just want to thank Donna. She drove 2.5 hours to be here with me. I'm so blessed to know you, Donna. Like, you just have completely changed the way I function as a fitness trainer. So I just want you guys to know that, like, everything that you see in me, from working with her for not that we worked closely together, but like we did for a while.
Mm-hmm.
I've known her for
Well, she
16
worked
years.
with me at Memorial Sloan Kettering. She was one of my personal trainers. So
it was,
I mean, it's been very exciting for me to come down and do this, because I want you to hear the passion that we have, the passion to keep you moving, the passion to motivate you to to prevent sedentary. So when you're standing up, get up, open those hip flexors, shake your body around, go up and down the stairs once or twice. Do what you need to do. The other thing I want to add is that if somewhere along the line you're doing something and you have a question, you can always write Esther, and she can always find me, and we can answer those questions for you.
yes, and you know where to find me. I have emails, I have DMs, I have Instagram, I have everything under the sun. So please reach out. Our goal for you is to live pain-free and just to be healthy. And thank you so much for your time watching this video, and I will see you back on the platform.
Thank you.